Dr. Christiaan Barnard was born on November 8, 1922, in Beaufort West, a small town in South Africa, into a modest family shaped by discipline, faith, and hardship. His father was a Dutch Reformed church minister, and the early exposure to illness and mortality, particularly the death of his younger brother from heart disease, left a deep impression on the young Barnard and quietly planted the seeds of a lifelong pursuit to conquer cardiac failure. After completing his medical education at the University of Cape Town, Barnard showed exceptional talent and relentless ambition, qualities that propelled him beyond the limitations of his environment. He traveled to the United States for advanced surgical training, where he studied under some of the world's most innovative heart surgeons, including Dr. Norman Shumway at Stanford University, who was pioneering experimental heart transplantation in animals. During this period, Barnard absorbed not only advanced surgical techniques, but also the courage required to challenge medical orthodoxy. He returned to South Africa armed with knowledge, confidence, and a burning resolve to push the boundaries of cardiac surgery. At Groote Schuur Hospital in Cape Town, Barnard built a highly skilled surgical team and introduced advanced procedures that were considered revolutionary for the time. He focused intensely on heart valve surgery, congenital heart defects, and the development of techniques that could sustain patients during complex cardiac operations. Despite global skepticism and ethical debates surrounding organ transplantation, Barnard believed that the science had matured enough to attempt what had never been achieved successfully in humans. By the mid-1960s, medical technologies such as heart-lung machines, improved anesthesia, and immunosuppressive drugs had reached a critical threshold. Barnard recognized that the moment had arrived, even if the world was not fully prepared for it. His confidence was not reckless bravado, but a calculated readiness born of years of preparation, experimentation, and study. Yet, the greatest obstacle was not surgical skill, but the moral and legal ambiguity surrounding death itself. Specifically, defining when a donor could be declared dead. Barnard courageously navigated this ethical frontier, understanding that progress often demands uncomfortable decisions. On December 3, 1967, when a young woman named Denise Darvall suffered fatal brain injuries in a car accident, Barnard recognized the unprecedented opportunity. With consent from her family and under conditions of extraordinary tension, Barnard prepared for what would become one of the most significant medical events in human history, knowing full well that success or failure would echo across generations. In the early hours of that historic day, Christiaan Barnard led his surgical team in performing the world's first successful human-to-human heart transplant on a 53-year-old patient named Louis Washkinski, who was dying from end-stage heart disease. The operation itself lasted several hours and demanded absolute precision, as the diseased heart was removed and replaced with a healthy donor heart in a procedure that had never before been completed successfully in a living human. When the new heart began to beat inside Washkinski's chest, it marked a moment that redefined the limits of modern medicine. Although Washkinski survived only 18 days, ultimately succumbing to pneumonia caused by immune suppression, the transplant was undeniably successful in proving that the human heart could be replaced and function within another body. The world reacted with astonishment, admiration, and controversy. Barnard instantly became an international figure, celebrated as a medical pioneer and scrutinized as a man who dared to play with the boundaries of life and death. Media outlets across the globe hailed the operation as a miracle of science, while ethicists and religious leaders debated its implications. Barnard, however, remained grounded in the belief that his work was driven by compassion for patients who had no other hope. He continued refining transplant techniques, achieving greater success with subsequent patients, including Philip Blayberg, who survived for over a year following a transplant, an extraordinary milestone at the time. Barnard's legacy extended far beyond a single operation. He transformed cardiac surgery into a field of boundless possibility and inspired generations of surgeons to pursue organ transplantation with renewed confidence. Despite facing criticism, political isolation due to apartheid-era South Africa, and personal health struggles, including severe arthritis, Barnard remained a towering figure in medicine. He later shifted his focus to research, writing, and global advocacy for medical innovation, emphasizing quality of life alongside technological progress. By the time of his death in 2001, Christiaan Barnard had permanently altered humanity's relationship with the heart, not merely as a symbol of emotion, but as a replaceable, reparable organ. His courage redefined what surgeons believed was possible. His success ignited the global transplant movement, and his legacy lives on in every heartbeat sustained by a transplanted heart today. Barnard did not merely transplant an organ. He transplanted hope into modern medicine, proving that even the most vital center of human life could be renewed through science, skill, and unwavering belief in progress.
In the history of medicine, few moments have resounded across the globe with such intensity as the dawn of heart transplantation, and at the center of that moment stood one man, Christiaan Barnard, a name now etched into the annals of science, not simply for what he did, but for how bravely he did it. Dr. Barnard, how a South African doctor transplanted the first human heart. Born on November 8, 1922, in the small arid town of Beaufort West in South Africa, Christiaan Barnard was the son of a Dutch Reformed Church minister. His upbringing was humble, marked by a stern religious household and a profound awareness of life's hardships. It was here, amidst the dust and silence of a remote village, that Barnard first encountered the pain of premature death. His brother, Johannes, died of a heart condition, igniting a fire within Christiaan that would burn for decades. He pursued a career in medicine with focused determination, earning his medical degree from the University of Cape Town. Driven by an unrelenting curiosity, Barnard furthered his training in the United States at the University of Minnesota, where he studied under Dr. Owen Wangenstein, one of the era's leading surgeons. There, Barnard immersed himself in the experimental world of cardiac surgery, learning techniques that had only recently become possible thanks to the heart-lung machine. Returning to South Africa, Barnard brought with him a vision that many dismissed as unrealistic. At Groote Schuur Hospital in Cape Town, he began performing pioneering surgeries on the heart, repairing valves, correcting defects, and slowly pushing the limits of what was medically acceptable. But even then, his thoughts were consumed by a question no one had yet answered successfully. Could a human heart be replaced? The idea wasn't entirely new. Transplant experiments had taken place in dogs and other animals, with mixed results, but the human heart remained off-limits, not just technically, but ethically. When does death truly occur? Could one heart be removed and another take its place, beating again in a new body? Barnard knew the road would be difficult, but he also knew it had to be walked. On December 2nd, 1967, a tragic accident brought possibility to the operating table. Denise Darvall, a young woman struck by a car, was declared brain dead. Her grieving father agreed to donate her heart. The recipient would be Louis Washkansky, a 54-year-old grocer with end-stage heart disease. The medical team prepped overnight. The world was unaware that history was about to shift. In the early hours of December 3rd, 1967, under bright surgical lights, Christiaan Barnard made the incision that would redefine human potential. The operation lasted nearly 5 hours. With steady hands and unwavering focus, Barnard removed Washkansky's failing heart and replaced it with Darvol's. For a moment, there was silence. Then the new heartbeat, strong, rhythmic, alive. Against all odds, it worked. The announcement reverberated around the globe. Newspapers splashed the headline across front pages, "Man lives with heart of another." Barnard became an instant international figure, hailed as both a genius and a gambler. Interviews, lectures, and invitations poured in. Yet amid the celebration came a sobering reminder. Washkansky survived only 18 days, succumbing to pneumonia caused by immune suppression. The surgery had succeeded, but the body's resistance to a foreign organ remained medicine's next great challenge. Still, the seed was planted. Barnard's next patient, Dr. Philip Bleiberg, lived for 19 months after receiving a new heart. Slowly, survival rates improved. Barnard refined his techniques, even pioneering the heterotopic transplant, a method where a second heart was added rather than replacing the original. But with every breakthrough came scrutiny. Religious leaders, ethicists, and doctors debated the implications of moving a heart from one person to another. Were they saving lives or crossing a sacred line? Barnard weathered the storms of controversy with a blend of charm and confidence. He understood the weight of what he had done. He also understood that history only remembers those willing to do what others fear. His fame grew beyond medicine. He became a celebrity, photographed with movie stars and politicians, his personal life often eclipsing his professional one. Yet behind the cameras, he remained a scientist, still chasing the next answer. By the late 1970s, Barnard's career in the operating room slowed. Arthritis in his hands made surgery more difficult. He retired from active surgery in 1983, but never stepped away from public life. He wrote extensively, promoted organ donation, and championed humanitarian causes. Though his hands could no longer cut, his voice remained sharp and influential. In 2001, while vacationing in Cyprus, Christiaan Barnard died of a severe asthma attack. He was 78. The world mourned the man who had, for a brief moment in time, held the human heart, both literally and symbolically, in his hands. His death marked the end of an era, but his legacy lives on in every patient who has ever received a second chance at life.